Welcome back. In a concerning health development on World Diabetes Day, a study published in the Lancet has revealed that India tops the list of countries with the highest number of people living with untreated diabetes. Now, according to the study, approximately 82.8 crore adults worldwide in 2022 were affected by diabetes. Among these, India accounted for over a quarter with 21.2 crore cases, followed by China, United States, Pakistan, and Brazil. The study also shows a startling increase in diabetes rates globally, especially in men, with cases more than doubled since the 1990s. In India, diabetes rates have nearly doubled for both genders over the last 3 decades, as per the Lancet report. Among women, the report surged from 11.9% in 1920 to 24% in 2022, while in men it rose from 11.3% to 21.4% during the same period. Now, despite these rising numbers, treatment coverage has seen only a marginal increase. Among Indian women, coverage improved from 21%, 1.6% to just 27.8% in 2022. Meanwhile, among men, it has gone up from 25.3% to 29.3% during the same period. Let me go across to my guests who are joining us to break down what this survey means for us. Dr. Ritesh Gupta, Senior Consultant and Diabetes Specialist, is joining me at this point. Also joining me is Ms. Amreen Sheikh, Head Dietitian as well at the Fortis Hospital here. Thank you both for joining me. Let me begin with you, Dr. Gupta. I want to get in your first expert opinion on the findings of this survey which has come up here. Do you believe these findings to be credible? And if so, how serious and what are the implications for Indians?
Yeah, so this is something which we already expected. This is what was projected. So if you see the statistics, say about 10 years ago, so it was always projected that it would come to this. So this is what is expected. It's a concern, of course. It's a major concern, and as you can see, the coverage is so poor. So coverage probably has increased slightly, but still there's a lot to be done. So it's a crisis of humongous proportions. I think one lesson which we can learn from this is we first need to do something about reducing the incidence of diabetes, as well as probably taking care of people who already have diabetes. So there's an urgent need to devise strategies to include all those patients who are not currently diagnosed or not currently receiving adequate treatment.
Okay. Amreen, let me bring you in at this point as well. The concerning figure is how diabetes rates has doubled for both men and women since 1990 year, which to my mind also coincides with the rise and the explosion of fast food as a craze in India, especially in urban Indians. How much of this increase in diabetes or the surge of diabetes patients in India has come down to the fact that our food habits and our lifestyle have also changed so drastically over the last 3 decades and not in a good way?
Yeah, so like Dr. Gupta rightly mentioned, there are many patients who are still undiagnosed with diabetes. And if you see the changes in current trends when we compare to last 3 decades, so a lot of food is easily available. There is a lot of convenience food that is available. Even food is easily available at your fingertips. We are just ordering from Swiggy, Zomato, and any other food platform. And people are not actually cooking food at home. If you see simple things like Indian snacks, also what we used to have at home, were usually homemade as compared to nowadays people are doing. Even Diwali, during the festivals, people opt to order from outside rather than cooking at home. So even that makes a lot of difference as in what you are eating and what kind of ingredients are being used while cooking. There's no control over fats or sugars or preservatives, which leads to all these kind of lifestyle diseases and metabolic diseases.
All right. Dr. Gupta,
so
another concerning aspect that came out from this... Yes, go on, Amreen. I thought you had completed your point. Please complete your point.
No, so that's what we have seen the changes in last over 3 decades, depending on their food intake, following fat diets, also followed by different kind of activities. Even that makes a lot of difference. Initially, there were people who used to do manual work, as compared to today, where people lead a sedentary lifestyle. So even that makes an impact on the diabetes and other metabolic diseases.
Indeed. Dr. Ritesh Gupta, another concerning aspect that came out from this Lancet study as to how there has been very little improvement in the treatment rate of diabetes, indicating that a vast number of people are still untreated and unaware that they have diabetes. Is it also because in our mind we still have a very antiquated notion of diabetes, meaning the fact that it's only if you have a lot of sweets, and completely unaware of type 2 diabetes and its impact and its possible causes as well?
Sure, sure. That is highly concerning. Now, the problem with diabetes is that, and also since diabetes is now being diagnosed at a relatively early age, so people are young, in their 30s, sometimes even in their 20s or even 40s. So these people do not have too many symptoms. So they have very non-specific features like fatigue or some pain or somewhere, but they don't have too many symptoms. They are able to do their routine activities. They're able to work. They're able to go to the office, everything. So there is a tendency to ignore control of sugars. There's a tendency to ignore, there's a tendency to not accept that they have diabetes, or even if they accept, just manage it half-heartedly or whatever. So I think that is something which needs to be understood as a population, as a society. We need to understand that it's a chronic disease. Just as smoking increases the risk of cancer and heart disease, in the same way, diabetes increases the risk of heart disease, risk of complications. And that is the reason we need to manage. And also, it's extremely important to understand, for a patient of diabetes to understand that is the initial years after diagnosis of diabetes, that one needs to control sugars very well. If you control sugars very well in those years, in the first 5 years, then probably you can stay away from complications for the rest of your life. But if the initial time is lost, then we actually end up having complications, even if you control it later on. So that is, I think, the major thing, that people don't have symptoms, and that is why people tend to ignore. And coupled with that, of course, there is lack of resources and all that. Yeah.
So then, Dr. Gupta, in terms of bringing awareness to our viewers who are watching this debate at this point, what are some of the red flags that our viewers can potentially look forward? If you mentioned that the symptoms are not very obvious and apparent to the body or to the eye, what are some of the red flags we could look at, or is the answer just in periodically checking our blood sugar levels?
Exactly. In fact, I think when one should not wait for red flags. Of course, if there are red flags, then you definitely need to do something. Red flags are if you're losing weight without any reason, or for that matter, if you have gained a lot of weight suddenly, or if you are visiting the washroom very often, if you are feeling very thirsty. These are some things which are known by everyone, or unexplained fatigue. But the most important thing is that even if you don't have any such symptoms, you need to check sugars periodically if you have any risk factors. Now, one of the biggest risk factors is being an Indian. Being a South Asian is a risk factor. So in US, anyone with South Asian ancestry is a risk for heart disease, is a risk for diabetes. So practically all Indians are at risk for diabetes. So all of us should get tested, maybe at the age of 30. That is the directive from Government of India. But there is an effort there is a consensus to lower that age from 30 to 25, actually, that you screen for diabetes periodically, maybe every 2 years, maybe every 3 years. And more so if you have a risk factor like family history, or if you are overweight. So do that. And of course, if you have those red flags, then you definitely visit your doctor.
All right. Thank you so much, Doctor, for your advice. Let me also get in Amreen Sheikh as well. Amreen now, in terms of prevention, of course, Doctor has pointed out about the the curative aspect about it, but in terms of prevention also, what are the dietary changes or the dietary factors that one must keep in mind? Because once again, I emphasize that for most Indians, they feel that, okay, if you don't have a lot of sweets or chocolates or ice cream, there's no risk of diabetes, but that could be further from the truth. So what are the dietary requirements or dietary habits that one should keep in mind in order to ensure that they're away from the threat of diabetes?
Yeah. Thank you. So that only dietary modification is not important. It has to be a lifestyle modification that I would recommend to all the people to prevent diabetes.
I was just coming to that aspect also, but do explain both. Yeah.
Yeah. So coming to diet, only sweets, ignoring sweets is not the thing. You have to avoid high carbohydrate food Okay, anything that is made with maida, your white flour, your refined flour should be avoided. Include more of fibers in your diet in terms of whole grains, millets, fresh fruits and vegetables, rather than going for, fancy smoothies and juices, because you're just discarding the healthy fiber. So that is also very important. Then decreasing the fat content in the food. It is not like having a fat-free diet, but fats which is good for your health, and the amount, it is not that you have to completely cut down on certain food groups. Just balancing your meals in terms of your good carbohydrate, good fats, and good amount of protein. That is what is recommended from diet point of view. And of course, not only diet, like I said, lifestyle modifications. So stress and physical activity and sleep cycle is very important, because even that leads to all these kind of metabolic disease.
So what are the lifestyle changes that one should look at, Amrinji?
Sorry?
So what are the lifestyle additions, like in terms of exercise, or is there a specific amount of workout which one should look at in order to specifically look at preventing diabetes?
So workout at least 5 to 6 days a week should be a combination of cardio and weight training both, because both are equally important when you're trying to lose weight and maintaining your diabetes or weight management. Then, like I mentioned, stress management is also very important. So if you're eating well, working out well, but your stress levels are high, even that will affect your diabetes levels and sugar levels. Also, sleep cycle. So you have to maintain a circadian rhythm for your own self.
Okay.
Set a timing, have proper amount of sleep. So even that makes a lot of difference.
All right, Amreen Sheikh and Dr. Gupta, thank you so much for joining us on this very illuminating chat we have had.